Good evening, everyone. My name is John B. Solanki, and I'm the Vice President of Clinical Programs here at Humber River Health. And
I'm Andre LaRoche. I'm the Chief of Obstetrics and Gynaecology at Humber River.
so it is an honor to welcome you to our first Fireside Chat to Unpause the Pause on Women's Health. This is an event that reflects our shared commitment to advancing women's health and wellness. First and foremost, I want to thank each of you for joining us today. Whether you're a healthcare professional, a researcher, patient advocate, community leader, or simply just passionate about supporting women's health, we appreciate you taking the time to be here. I'd also like to take a moment to express our appreciation to our sponsor, LaRoche Canada, whose generous support has made today possible.
LaRoche has partnered with Humber on many initiatives, such as launching our outpatient hysteroscopy clinic, as well as offering the Acessa ProVu for fibroid treatment. We are proud to maintain such a meaningful partnership with LaRoche Canada, focused on innovation, equity, and access to care for women across the lifespan. We also want to recognize our exceptional vendors who have contributed their time, expertise, and resources to enrich today's experience. The Women's Health Coalition Ontario Chapter, LaRoche, Humber River Health's Breast Health Clinic, and Humber River Health Foundation. Thank you for being here to share our insight and advocacy for women's health. This event is a celebration of progress, a platform for dialogue, and a call to action. Women's health is far too often dismissed, misunderstood, under-researched, underfunded, and the list goes on, making it challenging for women to access high-quality gynecologic and obstetrical care they both need and deserve. Janvier and I both started our leadership positions around the same time. When we started, we sat down and noted the inequities in our Northwest Toronto region. And wanted to bring the level of care people would expect at a university center to our community site. And we have been successful through initiatives, partnerships, and a supportive administration who saw and understood our vision and supported us throughout our mission.
So as Dr. LaRoche mentioned, we started out on this journey about 5 to 7 years ago, and really piece by piece have pieced this program together. And this program continues to evolve and expand as we have new team members joining, and we've really seen a shift in women's health and the care that we're able to deliver. Many more minimally invasive options, many more treatment options that make things faster, introduction of our CO2 laser, outpatient hysteroscopy. We can name many, many initiatives today that have made a significant difference in the Northwestern Toronto community. From periods, contraception, and childbirth to fibroid surgeries, colposcopies, cancer screening, and menopause, our Women's Health Center of Excellence provides women with a one-stop, collaborative, trusted place for gynecological care across the lifespan. And we have many of our obstetricians and gynecologists here in the room today who actually do all of this work, and they can share all of their experiences with you. Menopause represents a significant stage in women's health, yet it remains an area where system-level inequities persist across Ontario. Evidence shows that factors such as income, geography, race, and systemic bias shape access to timely diagnosis, appropriate treatment, and supportive care during all of these transition periods. Many times, this is not a topic that gets talked about very often. However, as a healthcare community, we have a responsibility to close these gaps, embed equity into our policies and practices, and ensure that every woman in our province experiences menopause with dignity, compassion, and comprehensive support. Throughout this event today, you'll hear from experts including Dr. LaRoche and Dr. Bruce Lee, the inventor of the Acessa ProVu Fibroid Procedure, who has generously shared his time with us today. We are so pleased to provide you with the opportunity to ask your questions and engage in meaningful conversations with others who share the same passion for improving women's health care. We'll be able to share some American perspectives today, some Canadian perspectives, and some of the journey questions as well that you may have in terms of how we've gotten here, how others have gotten here, and also the long journey that still exists as we talk about more things in today's conversations. During this fireside chat, there will be microphones available for you to ask your questions. However, should you prefer to ask your questions anonymously, please find the question box located at the right side of the auditorium to submit a written question as well. When we invest in women's health, we strengthen families, communities, and the future of care. Thank you again for being part of this important journey here at Humber. I'll now pass I'll now pass the microphone over to Elizabeth Cole, Senior Marketing Manager at Hologic, to present the Hologic Global Women's Health Index.
That's great. Hello, everyone. Thanks for coming out tonight. Thank you to Humber River for having us. As John V. and Andre said, my name is Elizabeth Call. I'm the Senior Marketing Manager for the Surgical Division at Hologic Canada. I'm honored to speak today here at Humber River alongside colleagues, healthcare leaders, innovators, and members of the public, all united by a shared commitment to improving women's health. At Hologic, our work is anchored in advancing solutions for women. In my division in particular, we focus on pioneering medical technologies for gynecologic surgery, helping to treat uterine conditions such as abnormal uterine bleeding, a challenge that impacting millions of women in Canada and globally every year. Acessa, used to treat uterine fibroids, is really why we're here at Humber River today. Hologic's dedication to women's health is comprehensive. Our company operates through 3 specialized divisions. The surgical division drives innovation in minimally invasive gynecologic procedures, as mentioned. Our diagnostics division works to improve early disease detection. In fact, since March 3rd of this year, every patient in Ontario who goes for their cervical cancer screening receives a Hologic Aptima HPV test result. Our breast and skeletal health division is a leader in breast screening, breast imaging, and bone health, fostering earlier intervention and better long-term outcomes. Our breast division was instrumental in contributing to the work and advocacy to lower the age of breast cancer screening in Ontario to 40. Every investment in Hologic is truly an investment in women's health innovation. Our research, technology, and global outreach are designed to close gaps in care and ensure women everywhere have access to advanced health solutions. So, and a bit of an uncomfortable truth. Despite comprising half the global population, women's health remains in crisis. Globally, only 5% of research and development funding is allocated to women's health, with just 1% going to non-cancer conditions. This creates a devastating ripple effect. The women's health gap leads to 75 million years of life lost due to poor health or early death annually. Here in Canada, the picture is equally concerning. Canadian women spend 20% more time in poor health compared to men. Women are 7 times more likely to be misdiagnosed during heart attacks because textbook symptoms were based on male patients. This isn't just about reproductive health, it's systemic inequality affecting everything from cardiovascular disease to autoimmune conditions. The economic cost of this is also staggering. Canada faces a $27 billion GDP gap due to health inequities, with the majority impacting women during their prime working years. So a little bit about the index itself. At Hologic, we believe in the science of sure, and that the innovations we develop are not just products, they are facts, data, and information. That's why we partnered with Gallup, the global analytics and advisory company, back in 2020 as part of the Gallup World Poll to create the world's most comprehensive women's health survey. We are now presenting the 4th year of data collection results. I invite you to visit the website, scan the QR code on the bookmarks that we're handing out at the Hologic booth to learn more about the index. It's really interesting to go into the website and see how, a country you may be from or a country you visited or Canada itself stack ranks against other countries. So definitely encourage you to check it out. The index methodology is rigorous. In 2023 alone, the last year the data was collected, 146,000 face-to-face and telephone interviews were conducted across 142 countries and territories, representing 97% of the global adult population. We track 5 key dimensions: preventative care, emotional health, opinions on health and safety, basic needs, and individual health. Canada's performance overall and the results were quite sobering. As you can see down here at the bottom, we rank 64th out of 142 countries and territories. Looking at the countries we often like to compare ourselves to, Australia ranks 43rd, the UK ranks 41st, the US ranks 38th. We rank 64th out of 142. Our index score was just 55 out of 100. This is on par with the global average of 53, but behind the average of the US, UK, and Australia at 59. This places Canada among the bottom performers in high-income countries for women's health outcomes. Remember that point. Over 4 years of data, Canada has shown only slight improvements, with some dimensions actually declining. We didn't expect that to happen post-pandemic, to be honest. This stagnation is unacceptable for a nation that prides itself on universal health care. The index reveals troubling gaps in Canadian women's healthcare that demand urgent attention. Preventative care is failing millions. In the previous year, millions of Canadian women said they went untested for potentially life-threatening conditions. Only 36% said they were tested for high blood pressure, 24% for diabetes, 15% for cancer, and just 12% for STDs or STIs. Pain and safety concerns persist. Over 1/3 of Canadian women said they spent much of the previous day in pain, while 40% said they didn't feel safe walking alone in their own communities at night. Healthcare access remains inadequate in Canada. Nearly half of Canadian women are dissatisfied with the availability and quality of the healthcare where they live. Meanwhile, basic needs go unmet. 19% struggled to afford food, and 15% said they couldn't afford shelter in the previous year. These aren't just statistics. They represent millions of Canadian women whose health and well-being are compromised by systemic failures. Innovation in women's health isn't just morally imperative, it's economically smart. Every dollar invested in women's health returns $3. The business case is undeniable. Investors are also taking notice. A recent study showed that women's health venture capital investment grew 55% in 2024 to $2.6 billion. But we need more. The consulting firm McKinsey estimates that closing the women's health gap could add $1 trillion to global GDP by 2040. Gaining just 7 healthy days per woman annually equals a full year of life over a lifetime. Innovation has a cost, but inefficiency costs more. When we fail to invest in women's health research, detection technologies, and inclusive care models, we pay the price in lost productivity, increased healthcare burden, and human suffering. The good news is that there are solutions being mapped and integrated into the proposals for country-specific women's health strategies. Back to the countries we like to compare ourselves to generally, Australia developed a national action plan on endometriosis back in 2018. The UK implemented a national women's health strategy in 2022. And last year, the US launched a $100 million White House initiative for women's health research. There are also increasing calls for an EU-wide strategy to be implemented across political and geographic divides. Canada is one of the only G7 countries with no national women's health strategy. Could this help explain why we scored just 55 out of 100? So here's my challenge to everyone. If you're a policymaker here in the room, study leading countries' women's health strategies and policies, create a Canadian-specific plan, providing a framework to raise research funding above the current 5% global average. If you're a healthcare leader, and there's lots in the room here today, advocate, as you do, of course, for gender-inclusive protocols and access, and demand better screening programs. Innovators and investors recognize that women's health represents the largest untapped market opportunity, and public health advocates, I think that's everyone here, use this index data and data from other sources to drive evidence-based change in your communities. The Hologic Global Women's Health Index shows us that women's health is in a state of emergency, but it also shows us the path forward. Let's commit today to moving Canadian women's health from measurement to action, from awareness to investment, and from crisis to breakthrough. Thank you very much. And I'd now like to invite Dr. Lesley Hawkins to the front to start our fireside chat. Thank you very much.
Thank you so much. Can everybody hear me okay? Good evening, everyone. I'm so happy to be here. My name is Lesley. I'm one of the OBGYNs here at Humber River Health, and I'm so pleased to look around the room and see all of you here today. Before we get to our fireside chat, which I'm so honored to moderate, I would like to ask you to come on a daydream with me. This morning, my 8-year-old daughter was getting dressed for school. And as 8-year-old daughters do, she couldn't figure out what to wear. She comes by it honestly, I think. So she told me, Mom, but it was more like, Mom, wouldn't it be cool if we invented a device where I could input the weather forecast and where I was going, and my closet would spit out a perfect outfit. And I said, like any parent would, yes, you should invent that. She said, yeah, Mom. Anyways, several long minutes later, she decided that she would wear one Hello Kitty sweater over another Hello Kitty sweater, and she went off to school with Dad. We daydream like this every day. We daydream in our everyday lives, we daydream in the hallways at work, we daydream in the operating room, and we think, what is something we could do to make things better? Imagine being in the middle of the surgery and something's not working well and you think, I wish this thing existed. I wish this new device was here, or I wish this system was different in order to achieve an outcome. And in healthcare, we think about our patients and we daydream about things that could make our patients' health better. It is rare to meet someone who has the capacity to be a change maker and take the daydream to reality. But tonight we have Dr. Bruce Lee here, who's going to share with us a bit of his experience with the Acessa procedure. So I'd like to ask Andre and Bruce to come up, and I'll introduce you. So Dr. Bruce Lee is a board-certified gynecologist who has over 35 years of clinical and research expertise. And he is the inventor of the Acessa fibroid procedure, which treats fibroids in women. In 2005, Bruce co-founded Halt Medical, which was designed to develop and create equipment related to the Acessa procedure. During his tenure as Chief Medical Officer, he oversaw Phase 2 and Phase 3 clinical trials, developed an education methodology to teach about the Acessa procedure. Since 2008, he has taught many surgeons globally how to do the Acessa procedure, including several here at Humber River Health. And through that, he has really just pioneered education in this area. He has worked towards creating 2 centers in the Los Angeles area dedicated specifically to the Acessa procedure. I'm so happy to have you here, Bruce.
Thank you very much. It's a great pleasure to be here.
We're happy to have you. Dr. LaRoche is our fearless chief of OBGYN here at Humber River Health, and he's held that position for the past 8 years. Dr. LaRoche trained in residency at McMaster University and then went on to the University of Ottawa to pursue his specialty and fellowship in minimally invasive surgery, endometriosis, and chronic pelvic pain. In his clinical practice, he focuses on chronic pain, endometriosis, medical and surgical treatment of fibroids. Andre is the first surgeon in Ontario to do the Acessa procedure, right here on the floor below you at Humber River. He holds faculty positions in our affiliated universities, including University of Toronto, Queen's University, and McMaster. So happy to have you here. Welcome.
Thank you.
I'll start it off, but we would welcome any questions from you. Let's start with the basics. Tell me, Andre, a little bit about what fibroids are and what their prevalence is in our population here.
Sure. So the question was, what are fibroids and what the prevalence is in our population? So fibroids are a benign tumor or solid mass in the uterus or the womb. And it's the muscle layer of the uterus that kind of grows abnormally in a usually circular fashion. And these can range in size from kind of millimeters up to several centimeters, up to 30 centimeters we've seen. And people can have multiple symptoms from that. Some have absolutely no symptoms. Most people have some form of symptoms of pressure, heavy or irregular periods, painful periods, pain with intercourse, just daily pain, urinary frequency, infertility, the whole spectrum of symptoms that can come along with fibroids. And it is a very common disorder, unfortunately. About 70% of women will have fibroids by age 50. 50% of those people will be symptomatic, but a small portion of those people will seek care for their symptoms. In our specific demographics of our Northwest Toronto population, we have a higher percentage of our population that has fibroids because of the African American, Afro-Caribbean population that we serve. The prevalence is 80 to 90% of those patients will have fibroids. And it's a significant impact to people's lives.
Yeah, I agree. We see so many fibroids, particularly in our community here, and I know that the OBGYNs in the back row over there would agree with me. But even more than our residency training, we are so surprised by the number that are in our community. So it's a great opportunity for us to make a difference in their lives. Bruce, talk us through Acessa. Talk us through how it came to be and what your vision was for it, and what you think we've achieved so far with Acessa. And then we also want to know a bit about the details of Acessa. How does it work? What can patients expect?
Great. First off, thank you everybody for having us here. It's a great pleasure to be back at Humber River again, a place that is very dear to me because Andre did the first procedure here, and I remember that very well.
That's great day.
I didn't dream of creating a new procedure. I didn't decide one day, I need to invent something. Instead, I learned about the technology of radiofrequency ablation by happenstance. And it just so happened that many events in my medical career had prepared me to essentially become the first person to apply this technology to something like fibroids. As I look back upon it, it's surprising that, yes, I had that experience, I had this experience, and this happened, and if one of those things didn't happen, I wouldn't have been able to do this. So it was somewhat happenstance or fate, however you want to look at it. But I was on the board of a surgery center in Monterey, California, and a general surgeon wished to perform radiofrequency ablation of liver cancer. None of us knew a doggone thing about radiofrequency ablation at that time. The FDA had just cleared it. And so they said, okay, Bruce, you're a tech guy, go figure this out. Should we allow this guy to do this in our surgery center now? And so I said, okay. So I researched literally everything written about radiofrequency ablation and liver cancer. I thought, oh, okay, this can work, but it would work better with fibroids. And it's still being used in treatment of liver cancer, and it's somewhat effective in certain categories of cases. But my thought was, light bulb, gee, we should do this for fibroids. Coincidentally, at the same time that week, I saw 3 patients who refused standard therapy for uterine fibroids, but they needed therapy. And one of them was a prominent district attorney, and she said, Bruce, okay, you're a smart guy, figure out another solution for me. I said, what do you mean figure out another solution? She said, yeah, figure out another way to treat fibroids. I said, well, funny you should mention that. Literally, just last week, I had a bit of an epiphany about this technology called radiofrequency ablation, but it's never been done before. She said, well, could you do it? I said, yes, I believe I could. And so she became my first patient. That's how smart I was. District attorney, yeah. Anyway, she was a terrific gal, and she did a wonderful service for women's health. And that was how I started. And as I treated that patient, the other 2 that week heard about it and they wanted it too. And then it just snowballed from there and there and there. And so I just kept doing the procedure, and the results were phenomenal. They weren't just good, they were phenomenal. So I kept doing cases. And then I presented at various medical conferences and eventually started a Halt Medical to develop the technology to make this grow. It was just too good to let go. I never imagined myself just a small town doc to become an inventor, so to speak, and to enter the business world of medical devices. But I think that's what life is about. It's not about always choosing your way. It's about finding your way. Or sometimes things find us. Mm-hmm. And I think that's kind of what happened in my life. Mm-hmm. And I'm just very grateful for that. Because we've been able to help many thousands of women already with this procedure, and we will continue to do so because Acessa is growing, it is spreading. Internationally in the US, Canada, overseas as well. Mm-hmm. And so anyway, I'm just very grateful to have been a part of it and to meet great docs like Andre along the way and work with them, and such a privilege in the great hospitals like Humber. Humber, by the way, does more Acessa procedures than anywhere in Canada, right? And so I'm very proud of that and how well the patients do. I hear about it in Southern California. Yeah, I do. So what does the procedure do? The standard way of treating fibroids has been to take out the uterus, do a hysterectomy, called an extirpative procedure. Another way is to cut out the fibroid, literally make an incision in the uterus, open the entire muscle, remove the fibroid. Now you have a hole in the muscle that's bleeding, and you need to close that, so you suture it closed in layers, and then you move on to the next fibroid. So it's rather a destructive process to the uterus. And that's why if you have that procedure, 80% of the time you're going to have scar tissue form, and that patient, if she does desire to have fertility and does conceive, she's not allowed to labor because we fear the uterus rupturing and opening. And then that's potentially fatal to the patient as well as the baby. So fibroids are a very real, major problem in this country. The costs are astronomical. It's really in excess of $50 billion annually in the US. Mm-hmm. And that's way over the cost of breast cancer, colon cancer, and ovarian cancer in the US. So fibroids are a huge problem in the US, but also worldwide. So instead of cutting the fibroids out, you destroy them with this technology, and then the symptoms resolve within 3 months. And you do this through 2 tiny incisions, 5 millimeters and 10 millimeters, and 1 needle puncture like getting your blood drawn, but in your tummy. That's it. Patients are up walking, eating, and drinking lightly the same day. My patients are driving in 2 to 3 days. Many go back to work on the 3rd day. While the FDA doesn't allow me to say that Acessa is indicated for women who want to get pregnant, I designed Acessa for women who wish to conceive. I just got an email today about another patient who conceived after Acessa, and I have probably 65 pregnancies in the last 5 years of mostly infertile women who were able to conceive and then deliver after Acessa. So it's a great boon for women's health not to have a major surgery to either lose your uterus or cut the uterus open and remove it. I see patients every day, I speak to patients every day who say, my doctor says doing a hysterectomy is the only way. That's my only option. That's not true anymore. And docs like Andre here and Lynn are doing that here and making that possible for the population here. So,
And Kate Pizzuto.
Mm-hmm. And Kate, we've not met.
Yeah.
I'm sorry. I know the name. So I'm just happy to be here, and thank you for allowing me to tell the story.
Thanks so much, Bruce. Yeah, I'll just highlight Kate and Lynn at the back who can wave. our other Acessa surgeons. Feel free to chat with them and ask them questions after the chat. And thanks for being here. Andre, talk to me about your experience in our population with Acessa, how you see it benefiting particularly our population here in the Northwest, and how it bridges gaps in inequity in healthcare for women's health.
Yeah, absolutely. So introducing Acessa has been an amazing opportunity for patients in Canada, but also specifically for our Northwest Toronto population because of the high prevalence of fibroids in this community. But also a lot of patients are in, say, positions where they're not able to take 6 weeks off work because of a major laparotomy, so a huge cut, having a hysterectomy, and then potentially having complications after their hysterectomy and being readmitted to the hospital and having to arrange childcare. And the Acessa procedure allows patients to go home the same day, typically back to work 3 days, I'd say maybe
A week?
5. Yeah, in a week, say in a week. But a week is a lot more digestible to people than taking 6 weeks off of work with minimal pain. So patients have, maybe will take 1 or 2 tablets of narcotics, the rest is Tylenol and Advil, and they're back to work fairly quickly. And their symptoms are resolving, like Bruce said, within a couple of months. Some of their symptoms resolve within a couple of days to weeks, depending on what the symptoms are. And it offers an opportunity to have treatment for a very, very common and undertreated condition. So it's opening more doors for patients.
Yeah.
There's part 2 to your question.
I just want to hear a bit more about that bridge to the inequity gap. I think you pointed out one big thing, especially for our population, which are folks who are working hard and need to be home taking care of their families, and they're having a shorter hospital stay. Any specific patient experiences with that? Patients who have been or interested in Acessa because of that?
Yeah, so I think so there's 2 kind of populations of patients that we see for Acessa. There's the patients that we see that were referred because of either heavy periods or heavy bleeding or known fibroids, and then we offer Acessa as one of the options available to them. And then there's the patients that have known about Acessa, they knew it was going to come to Canada, and they've been waiting for years and years and years to finally have this procedure done. Because they have done their research, they know what's best for them and their bodies, and this is what they really wanted. And they waited all this time. But all that time that they've been waiting, they've been suffering, missing work, suffering from symptoms, having a poor quality of life like we saw from Elizabeth's talk. And this has allowed us to introduce this treatment and treat patients quicker, faster, with less complications, faster recovery, and get patients back to work, back to their families, and improving their quality of lives much faster than what we could have before.
That's amazing. Tell me a little bit about how many procedures we estimate that we've done here at Humber, and how the program has evolved since you started specifically here at Humber, and what that looks like, and maybe what's next for us here. And then I'd love to hear Bruce's kind of vision for what's next globally, really.
Yeah, so when we first started being the only surgeon initially at our site, it was a little lonely. I won't say it wasn't lonely. But it was nice being the first person, because then that allowed me to kind of ramp up, become the expert in the area at our site anyways, and then start to train others at our site. So then kind of onboarding Lynn Sterling with the procedure, and then Kate Pizzuto with the procedure, and continuing to work on increasing the number of physicians at our site that are providing this procedure. And so up to date, we've done a couple of hundred, I'd say probably 150 over the last 2.5 to 3 years now. Understanding that it was one person doing these procedures initially, but now kind of our numbers were slow and then kind of ramping up quickly now. And we've been fortunate at our site to have a lot of surgical time, which has allowed us to kind of get these numbers in and be the highest volume center in the country. But what that also allows us to do is become to be experts in the area, and then start training other physicians from other hospitals within Ontario, but also from other provinces across the country. And they are coming to our site to learn the technology, learn what we have to offer, and not only seeing Acessa, but seeing kind of the whole gamut of things that our hospital has to offer, and bringing those ideas and concepts back to their centers to improve women's health across the country.
That's so great. What's going to be next for you three as a team in terms of Acessa program, access to care, and can you just clarify for us as well that this procedure is OHIP covered?
Mm-hmm. Yeah, so it's a bit of a gray zone. So we are paid by OHIP to do the procedure. It is not officially an OHIP funded procedure in that there's no specific code just for Acessa. But there is a radiology code that the description is close enough to Acessa that we're funded for the procedure, which is great, because sometimes what happens with the introduction of new technology is that there's a significant delay in OHIP's funding of new procedures, where then the physician's not getting paid or the patient has to pay out of pocket for the procedure. So this is allowing us to continue on providing this amazing procedure for patients that wouldn't be able to afford the procedure. What's next for us? So, I mean, as we continue to grow our volumes, we are in the midst of publishing our first project, our first research project in the first 60 patients that we did this procedure on. And then our next project is underway right now. So starting to get data out of our procedure that we're doing, having such high volumes, being able to provide kind of real-time Canadian data on what the outcomes are for the procedure, patient outcomes, patient sentiment, how patients have felt from an equity lens also, having had the procedure done, and then getting that and disseminating that information across the country.
Amazing. That's so great. Bruce, what's next globally? Or in your world?
Well, slide. I think dealing with the inequity issue is a big thing. And that's partly what Acessa is about. The medical literature abounds with data demonstrating that women of color or other minorities ethnically don't have access or have not received more highly technical procedures. My goal always was to have Acessa available to everybody, and that's what it was for. When I first developed this, I had many investors come to me wanting to take command of Acessa and make it an elite procedure for the wealthy. And I said, no, that's not what this is about. That's not why we're doing this. And so that's still very important to me as a goal. And I'd like to say it's also very important to Hologic. Hologic is about women's health. Hologic is about equality. And they work hard to make sure that this procedure is available in all areas of the world to other people. And that's really what's coming next, is to spread it overseas. I hear it's either going to be Australia, New Zealand, or the UK, or the next country to adopt Acessa. I've had the great pleasure of working here in Canada over the last 3 to 4 years with Elizabeth and everybody else here from Hologic, and it's been quite an honor to work with them and bring this here. So I hope I get to be involved in bringing it to the other countries as well. But there are more advancements coming. There are ways to improve Acessa even further. And I am happy to say that we have made some advances in that will make the procedure faster, less expensive, therefore. And that will hopefully make it more available to everyone as well. So that's coming down the road, we hope. And, and so this has started a movement. Acessa really has started a movement toward non-extirpative treatment of fibroids. So at our medical OBGYN conferences now, before it was only talk regarding fibroids, it was only talking about how to take out the uterus, how to cut out the fibroids. Now it's about, do you cut them out or do you preserve the uterus and treat conservatively? That is a big change in thought. Someone was just asking me about when I first started to present this at organizations, what was my reception? And I said it was quite chilly because I was presenting something that people didn't know about, and it wasn't well received. It's quite a bit warmer now, thank goodness. I think we're making progress. And I think that we're going in the right direction. So that's what I think is coming. More and more physicians are learning about Acessa. Every residency program in the US now their graduating residents have at least heard about Acessa.
Amazing.
4 or 5 years ago, essentially none of them did. So change takes time. It takes effort, it takes great doctors, takes great organizations, and it takes willpower. And I think we have all of those things working towards women's health. And again, I'm just grateful to be a part of it.
Thanks to you for having all of those qualities and leading the charge. We have a few questions from the audience. Andre, if a patient has multiple fibroids, how many can you treat at once with Acessa? And what percentage or proportion of patients will have a successful outcome after Acessa?
So there's no real limit on the amount of fibroids that we can treat, as long as we have some space in the abdomen laparoscopically, have enough room to do the procedure. There's no limit on the amount of fibroids. I'm sure Bruce has much higher numbers of the amount of fibroids he's treated. I think upwards of around 20 or so is the most I've done on some patients. 96.
Did you know that Bruce's total fibroid count is over 4,000?
It's over 30,000.
Over
What?
30,000. So
Oh my goodness.
I'm not sure what you can hear, but Bruce has treated over 30,000 fibroids in his career so far, and counting. So there's no limit on the amount of fibroids that you can treat. As long as you can see them, you can treat them. The part two of your question.
Part two is there a sense of the proportion of patients who will experience
Oh, right.
success?
Yeah.
And I guess,
Right.
what do we define success as with Acessa, right? Like, what are we looking for? What is the outcome that we could expect for the patient?
Yeah. So the success rates are very high with Acessa, upwards of 90% for improvement of symptoms and satisfaction of the procedure. And the success rate, I think you have to think about it so there's two ways that you can look at it. Either the size of the fibroid shrinking or patient symptoms, or a combination of both. So it improves all of those things. However, in kind of interesting talking about equity lens, so we're very fortunate in Toronto to be able to have great access to imaging. So if I want a patient to have an ultrasound next week, probably can get it. Whereas other places in Canada, such as in Saskatchewan, or Saskatchewan and Regina, which was the other initial site where Acessa started, they have significant delays, like months, to get an ultrasound done. So when we started the procedure here, we followed patients kind of the same way that Bruce does, at 3 months, 6 months, and 12 months with repeat ultrasounds and asking the patients about their symptoms. But out west, because of the inability to access ultrasound or MRI, they did purely symptom-based. So if their symptoms improved, great, we didn't look any further with ultrasound. If their symptoms didn't improve, then they looked with ultrasound. So that just kind of shows that everybody looks a little bit differently and follows up
Right.
things a little bit differently.
Right.
But you don't always have to think about the size of the fibroid. Mostly the improvement in your symptoms is really
Right.
where your success comes in.
Right. Right. That makes sense. And that's really what's going to change the patient's quality of life. So are you using some questionnaires to help determine that here at Humber? What's your protocol for follow-up?
Yeah, absolutely. So the three of us that are doing the procedure now have kind of standardized our follow-up for patients. So we typically see patients around the 2-week mark just for a check-in, and then we see them again at 3 months, 6 months, and 12 months. And we have a standardized fibroid quality of life questionnaire that we ask them, that they fill out for us, and then we go over it with them to watch their improvement in their scores over time. And when there isn't an improvement for some reason, then we start to kind of dig in more. Is there something else going on? Typically there is something non-related to the fibroids. And we still do track the size of fibroids because we want that information just more for data and research long term. But we do follow that information as well. But we're doing the improvement in quality of life assessment at every visit.
That's amazing, because that's what patients are coming to us for and asking us about. So it's amazing to see the strides that Acessa can make in impacting someone's quality of life. That's incredible.
If I might.
Yes, please.
Acessa also has the unique ability to detect very small fibroids. Because we're using laparoscopic ultrasound inside the abdomen, right on the surface of the uterus. Far, far superior to MRI or standard transvaginal or transabdominal ultrasound. So it is literally the best way to see fibroids that exist. And you might ask, well, why bother with small fibroids? Well, because small fibroids become big. They all start little and they grow over time, right? But if you ignore the small fibroids or don't see them or don't treat them, then patients are returning and returning and returning.
Yeah.
The data shows with myomectomy, many patients have to return multiple times. And that's unfortunate for the patient, obviously, with increased morbidity and cost, but it's also a drain to the healthcare system. With Acessa, you can be very complete. You can literally see fibroids that are 2 millimeters and destroy those. And then that little 2 millimeter fibroid that is not causing a problem now won't cause a problem 3 or 5 years from now. And you are saving that patient from having to return for more procedures or have more morbidity in the future. I think that's extremely important. And you are also creating a relatively longer symptom-free period for the patient, and a longer period where that patient's fertility is preserved. Because fibroids do cause infertility some of the time, not with every patient, but they also cause pregnancy complications as well. So fibroids are a complicated thing. They affect women in so many different ways, whether it be heavy bleeding, painful periods, painful relations, bladder issues, digestive issues, and so fibroids are certainly very, very important to a woman's sense of identity. And I think that offering women a way to preserve the uterus and keep it functioning normally is a good thing. And that's what Acessa allows.
And that's actually one of the things, as you were talking about, I was thinking about the patients that we see frequently, especially in this Northwest Toronto demographic, is that a lot of patients have avoided surgery for so long or any treatment of their fibroids because of a fear of losing their uterus. Regardless of desire for pregnancy or not, they could be 48, but still want to maintain. It's very important culturally for them to retain their uterus. And even though we can do a myomectomy, there is a risk of having a hysterectomy doing a myomectomy. So this is now allowing patients that were avoiding care and affecting their quality of life for so many years to now have a treatment where the risk of hysterectomy it's never zero, but it would be almost zero. And improve their quality of life significantly with a minimally invasive procedure.
And along the same lines, myomectomy leaves fibroids behind at least 80% of the time, at least. How do we know that? It all started with a bet I had with a friend from UCLA. He did laparoscopic myomectomies, quite good at it, by the way. And I said, "You're leaving fibroids behind, lots of times." He said, "No, I'm not." "Yes, you are." "No, I'm not." "Yes, you are." "You want to bet?" "Sure." "What do you want to bet?" $1. So he bet $1. So I said, "You do a trial where you remove every fibroid that you see on pre-op MRI with your laparoscopic myomectomy." He says, "I can do that." And then you do laparoscopic ultrasound before the patient wakes up. And you figure out how many times you find more fibroids. I still have the $1. So in that way, it's a better procedure than a myomectomy, right? Because we are treating more fibroids. We're not leaving them behind to grow. And then the patient goes back for another myomectomy, and then just another one, and over and over again. So that is really, in my view, and I personally tell my patients that my belief is that Acessa is the most thorough procedure for uterine fibroids other than a hysterectomy. And so I think that's a very big advantage.
Absolutely. And every single gynecology clinic that I do, there's an ultrasound that says that someone has fibroids. And it will measure 1, 2, maybe 3 fibroids, right? And then I'll go to the operating room and get in there, and there is always way more than the ultrasound said there was. So that's an amazing, amazing application for this. And just to comment on the tech, this is really amazing. So Bruce is describing the way the procedure works, which is that an ultrasound wand is going inside the patient and right against the fibroid uterus and looking through the muscle layers of the uterus to find those fibroids that we can't see on traditional ultrasound. It is amazing to watch, just so awesome. As surgeons and our tech, we love that stuff. Okay, so we're gonna wrap it up with a final question I'll ask Andre. If there's a patient, a family member, an aunt, a sister, someone who has fibroids and they're having difficulty accessing care, particularly here in our community, what do you suggest that they do? What are the steps and what should they chat about with their doctor?
Yeah, absolutely. So, obviously the first step is to ask their family physician for a referral to a gynecologist. At our site, we do have 17, I'd say, gynecologists that are working in our department, 3 of which are doing the Acessa procedure. 16, 17. All of which can be found on our website at the hospital. 3 of us that are doing the Acessa procedure. But if there's difficulty in accessing, like getting referral to one of the local gynecologists, so just need to reach out. Our emails are on the website. The family physicians can reach out to us to say, I have this patient that's really having a difficult time accessing care, and we'll try to get those patients in and see them. It is difficult because of the overwhelming amount of patients that do have fibroids that need treatment. So it is hard. We try to do our best and see patients as fast and as thoroughly as possible, but it does end up being tricky.
Yeah, for sure, for sure. Okay, well, thank you so much. Thank you for your time and expertise. Thanks to you both for the strides that you are making over many years in serving our population and our communities. We are so grateful for both of you, and thanks for your time tonight. That was great.
Thank you.
I think next we have some closing remarks for Barb. Thanks, Barb. Thank you.
Thank you, everyone, for being here. I'm Barb Collins, and I'm President and CEO of the hospital. First of all, thank you, Dr. Hawkins, and thank you to both of our physicians, Dr. LaRoche and Dr. Lee, for all of your information and explaining it. We do have mechanisms for primary care physicians who want to reach out for care, including our SCOPE program, and I want to make sure that we've got this on there. I'm pretty sure we do, but getting a referral to a gynecologist. I want to thank all of you for joining us for this chat on Unpause, the Pause in Women's Health. At Humber, we are a leading example of turning bold visions into life-changing realities and helping women feel empowered and understand the options available to them. That is because of our gynecology team, of our gynecologists, our surgical, and our women's health leadership teams. As a CEO, I will tell you that probably a week doesn't go by when they don't bring a new idea of something they want. But you know what? That's what benefits us. And I think often you do keep in mind the benefit to our community where people can't take time off and can't seek care. So this particularly, the Acessa procedure has been a great one to introduce for our community. But at Humber, we're driven to make gynecology services more accessible and provide women with minimally invasive, closer to home care. And we've demonstrated a history of saying yes, paving the way, and refining what's possible. Now, sometimes the yes is probably not fast enough, and you have to jump through hoops. But anyway, we do eventually do the yes. As you're aware, in 2022, then Dr. LaRoche performed the first Acessa ProVu procedure in the province. We were actually one of 2 centers in Canada. We now have 3 surgeons doing that procedure, and of course, are equipped to provide more procedures in the future. In 2020, we actually led an initiative with Women's College Hospital in collaboration with Sunnybrook and Mount Sinai, where surgeons came here and used some of our OR time and our equipment to do procedures, and we're probably going to launch that again. That is because the delay in women's surgery, women's health surgery, gynecology surgery has one of the longest waiting lists, and it's kind of an interesting comment on why. Last year, our colposcopy clinic acquired an ultrapulse CO2 laser, again allowing for minimally invasive care for various gynecological procedures. And Humber services more than 55% of the region. So a lot of patients come to us for care. The list goes on, and through our upcoming Women's Center of Innovation, we'll continue to reinvent the future of women's health care through research and innovation. I want to thank our partners at LaRoche Canada for both participating in and sponsoring today's event. We do appreciate your continued support of Humber to improve women's health in our community and both here at the hospital as well. And if I think I heard maybe the price is going to drop a little, I'm even more excited. Thank you. That's the financial side of it. I had to say it. Thank you to our vendors for sharing your time and resources with us, to the team at Peter and Paul's for the catering, and to the members of the team that helped plan the event. Thank you very much, Dr. Hawkins. Thank you very much for moderating. It's a tough job sometimes, but you did a great job, so thank you. Before you leave this evening, I invite you to network, purchase raffle tickets, and take part in the vendor exhibits, which are just outside the auditorium. Let's carry the momentum forward as we continue to share knowledge and champion equity in women's health. I'm going to take a moment now to invite Jennifer Stewart, who's our new president and CEO of the Humber River Health Foundation, to highlight some of our upcoming initiatives to support women's health.
So, sometimes the only thing that stands between reality and the dream is money. So when you hear about a project like this and what's been accomplished for 150 women already, we couldn't not buy this. So thanks to donor support, we were able to buy this equipment so that we're actually changing the lives of 150 women plus. The other thing that we have to remember is that we women want to support each other. So we're creating a new initiative within the foundation, Humber Heals, not H-E-A-L-S, H-E-E-L-S. Very clever. So this is where we're going to bring your voice, your values, your health, your Humber, all together in one room. So we're going to invite 100 women to make a donation to Humber, $2,500. And we're going to take those 100 versions of $2,500 and make $250,000. And we're going to put it in a pool. And then, because we like to hang out with each other and have a good time, we're going to have 3 events for these women. Each of these events are going to be fun and strategic. We are going to maybe sip a little bit of wine, but definitely learn a little bit more about our health, learn a little bit more about our hospital, learn a little bit more about how to access care, and to hear about projects like you just heard tonight. I had a colleague 20 years ago who came to me to ask me for 6 weeks off of work because she had fibroids. I forgot about the story until tonight. I remember her telling me they were the size of grapefruits, and I thought, gigantic, that is a grapefruit. And so she did. She took 6 weeks off work. It was a difficult journey for her. She never did conceive. So when I hear about what you've done, how you're helping these women, outstanding. So once a year, us women are going to come together, and not only are we going to have a little bit of wine, but we're going to invite 3 projects from our Women's Health Division. And we are going to vote on which one of those projects get our money. And we will enable women like what you've helped. We will be the ones bringing our health forward. So we invite all of you gals tonight to get involved. Daniela over here, I've got 2 of them, but Daniela with 2 L's, she will help you sign up if you'd like to get involved. We're just launching it. And if you want to do it, we want to have you. But gentlemen, because I do see a few of them in the room, don't despair. The men's version is following. Okay, so enjoy, eat, drink. Thank you to our speakers. Thank you to our donors. And I look forward to getting to know you all.